Hi everyone, my name is Hugh Lee. Today I would like to present my topic of antibiotic resistance due to antimicrobial drugs misuse among Latino community. After these presentations, I hope you guys gonna learn a little bit about the causes of antibiotic resistance crisis in public health setting, as well as know the current climate of the misuse of antibiotics among Latinos also know how to explain the major misconceptions, the cultural misconception about antibiotics use, and figure out the way for our future directions. Now, so how are we doing in terms of antibiotics use among Latino in the United States? Well, in the United States, actually over 90 million people have inadequate levels of health literacy. And Latinos is as far more likely to be at the below basic levels in health literacy. This is the reason why uh, they have a problem understanding the doctors, understanding the way to carry themselves in terms of their health outcomes, and significantly reduce their knowledge and understand to make appropriate health decisions. So, what does it do for the antibiotics use? So, they tend to self medicate themselves without the doctor prescriptions, and they tend to use antibiotics as a magical medications to cure all kind of disease due to the fact that they experienced before the symptoms and complications. And this is the reason why they give uh, the chance for antimicrobial the resistance raised to keep increasing and become one of the large reservoir of antibiotic resistance in the United States. When you think about it, affect the whole entire community, not only their community but also others too. That's why I do need. It's very important to address interventions in this, of course, in this community as well as uh, our other communities as at large. And so, causes of antibiotic resistance, the basic science of antibiotic resistance. Um, Basically, microbiologist has determined that antibiotic resistance is a natural process by which bacteria develop resistance over time, which reduce or eliminate the effectiveness of medicine used to treat illness that's caused in human and animal. So, World Health Organizations call it worse cases than AIDS, HIV/AIDS epidemic, which has caused 25 million deaths worldwide. So, antibiotic resistance is even worse than that. So, of course, the causes is the cause. Of course, they self-medicate themselves, and because they have a lower health literacy. So now let's talk about culture. The cultural misconception that lead them to the misuse of uh, antibiotic. Every culture, ethnicity group has its own perspective, a traditional belief about health practice, right? And their health practice based on their cultural belief going to directly influence their disease treatments and values to the healthcare system. Researchers has reported that Latino tend to see physicians for simple illness. For what? Just to receive antibiotics or bring their children to physician office, hospital to obtain antibiotic without prescription. When the symptoms are familiar with whatever they experienced before, they seek for the treatment that was successful during prior episode. Consequently, the first line medical worker in their mind is not medical doctors or healthcare provider anymore. They would be pharmacists. And the pharmacists they looking for sometimes might not be the pharmacist, where everybody go. It's their little stores, little pharmacies, as known as tienda. They find the sources antibiotics transported from their own country because they believe is more effective, is close to whatever they used before. And of course, Latino has challenges with the cost of healthcare and healthcare insurance, uh, which weigh against the benefit of a physician visit, and this also play a significant role in for public health professionals to encourage them about the proper use of antibiotics. Um, so Latino are more likely than any other racial and ethnic group to have a highest uninsured rate, and the enrollment on the individual health insurance resources in disproportionately low among Hispanic. Um, Also, other cultural belief is that they believe it's not it's only important to take their children to the physicians for diagnosis and treatment, but not themselves. Adults who have previously been treated for recognizable symptoms such as fever, diarrhea, and sore throat tend to feel more comfortable in delaying another physician visit and self-medicate themselves. Language also a barrier that frequently contribute to poor medication adherence and negatively impact on good health seeking behavior. If even they find doctors who can speak Spanish, they still often could not truly interpret the medical terminology and instructions. It is health literacies that's still a big concern among Latino community. So, what we can do about this? What we can do is recognize our current interventions has been designed to target mainstream populations in the United States and the role of physicians in antibiotic prescription, but not too much into targeting Latino populations. As a public health professional, I would recommend to bring awareness to by providing them like let's say video presentation poster and health brochures in the local health event, in their public place such as church. I also would collaborate with community-based organizations, write proposal local or federal grant to purchase flu over-the-counter remedies and relief medication, because we need to make them understand their symptoms and their complication might not be resulted from a bacterial infection, but it might be viral infection. So they need not to use a micro antibiotic for the simple infection caused by virus. We also need to bring it into school, uh, because education play a very important role in educating young Latino. So, because they're more fluent in English, so they can bring it home, educate their parents. At the same time, we also educated their parents. The parents are in Spanish and English, within a cultural competence means of communication about clinical consequences of antibiotic use, misuse, to both recent immigrants and other Latino communities, so we can both target younger population and older population. We also look at the the policies, the government policies that need to be revised with considerations given to the law restricting antibiotic sales, as well as tightening regulation to reduce adverse effects of non-prescribed antimicrobial drugs, and to pose a higher legal risk of being five or closer of this business. So we look at the federal dimension of these issues. So future directions. Um, as a report, we do not have a lot of interventions for this community that has been documented. That's why we need more research as far as Latino community social constraints and cultural view are concerned. We need people to get away from the mainstream of general U.S. populations. We want to make sure that educational materials should be developed and widely distributed to them and infectious conditions that require antibiotic treatment shouldn't be too often in whenever when it comes to cure. Thank you for listening.